Are you secretly sabotaging your smile without even knowing it? Stick around with this video and we're going to find out what the top 5 worst dental habits are. Hi, my name's Connor, I'm a dentist and I've been a dentist for the last 10 years and I make videos here on YouTube for people who want to learn more about their teeth and how best to look after them. If that sounds like something that you might be interested in, then hit the like button, hit the subscribe button and follow along for more videos. Okay, so the first one that I'm going to talk about is biting your nails or nail biting. This will start to cause little microchips on the edge of your front teeth. It can even start to make them chip a little bit. It can make them weaker. It can make the edges of them look uneven, and it will give your teeth a worn and fragile appearance. This doesn't just apply to biting your nails, this can apply to anything. If you're chewing on the end of a pencil or on the end of a pen, any kind of foreign object like that that's going under your mouth that you're biting on can start to cause this problem as well. If you are particularly unlucky, you may even break a tooth by doing this. Okay, so moving on to number 2, this is piercings, and specifically piercings in your mouth. Now, before I get absolutely slated in the comments, I know that this does not apply to every single piercing that you can have in your mouth, but in particular, if you have a piercing on your tongue or on your lip, or any piercing that's in close proximity to the teeth or the gums, that can start to wear away the teeth, but also start to cause the gums to recede as well. Another thing to kind of think about with piercings is it's really important to keep them clean. So using something like Corsedal or an antibacterial mouthwash every so often just to make sure that it's kept nice and clean is really important. Okay, and number 3, this is kind of the first big one, smoking. Smoking is one of the worst things that you can do for your oral health. It will predispose you to a lot of different things, things like gum disease, cavities, if you've had a tooth taken out, dry socket as well, but also the bigger picture, oral cancer. Not only is it bad for you, the health of your mouth, but in your general health as well, smoking is not something that would be very beneficial for you. Kind of on a more cosmetic level, it's going to cause bad breath, it's going to cause yellow teeth, stained teeth. It's just something you should avoid altogether. And this doesn't just apply to smoking, this applies to vapes as well. So the research isn't fully there about vapes, but it seems to be going in that direction, that it's going to have similar effects on your teeth and gums as to what smoking does. So it's best just to avoid it altogether. Okay, so number 4 on this list is teeth are not tools. And I don't know how many videos I've seen on social media of people trying to open a bottle, chewing on ice, the corn thing with the drill. Yeah, just it's not a good idea. It's going to break teeth. At the very least, if your tooth doesn't break in the process of doing this, it can start to cause little micro cracks in it, and you might not be aware of that, and it could be something completely random then that you're eating, you know, like a piece of bread or a piece of toast and a part of your tooth falls off. You're like, oh well, why did that happen? If your tooth does break, best case scenario is that it's a small chip and that can be repaired with, you know, a filling or just getting smoothened off, but inevitably the tooth is going to be weaker than what it was before. If you are not so lucky, then you know, you could end up losing the tooth, need an extraction, or a root canal, and a crown might be the alternative then as well. But it's just not a good idea in general. Don't use your teeth for things that we have other tools for. And the last one on this list, which might be a bit surprising to some people, but mouthwash. It's not that mouthwash is inherently bad for your teeth, but the way that people use it, the habit of the way that they use it is not correct. Mouthwash has a lower concentration of fluoride than what toothpaste has. So if you brush your teeth with toothpaste and immediately after that, if you rinse your mouth with mouthwash, then it's going to dilute and wash away the effect of the toothpaste on your teeth. So you're essentially not giving yourself the same protection that you would from toothpaste. If you are going to use mouthwash, and I'm not saying don't use mouthwash ever, but if you're going to use mouthwash, be careful as to where you use it in your routine. I would say either use it first or maybe floss your teeth, then do the mouthwash and then brush your teeth with toothpaste. That could work. I think the most important thing here is after you're done with your toothpaste, just spit out the toothpaste. Don't rinse your mouth with mouthwash or water because you're only going to lose the effect of the fluoride on your teeth. Other thing that people don't really realize with mouthwash as well, particularly a mouthwash like Corsadol that I've talked about before, it can stay in your teeth in the long term. So you might be thinking, oh, okay, I'm going to get really fresh, clean teeth, but actually you're causing stains. The other thing with mouthwash is there's alcohol and non-alcohol mouthwashes. If you use an alcohol-based mouthwash, it can actually dry out your mouth. And when you have a dry mouth, that's when bacteria are going to start to thrive and grow more. And the more bacteria you have in the mouth, the worse your breath is going to be. So the very thing that we're probably trying to combat most with mouthwash, getting fresher breath, we're actually doing the exact opposite, and we're going to be encouraging bacteria to grow. So I would go for a non-alcoholic mouthwash. If you enjoyed that video, then YouTube thinks that you might like this video next, so give it a watch as well.